guys, Dr. Crocker again from Northwest Animal Hospital. Today we are going to talk about cat dental disease. And I'm going to tell you, it makes me sweat a little bit when I start talking about cat dental disease because cats are tricky. They like to have a majority of the disease under the gum line. 70% of the disease is under the gum line in cats. So it's very difficult to just examine a cat's mouth. One, because cats don't like their mouths touched. And two, because the disease is often hidden and you're not going to see what's going on. So I'm going to explain a little bit to you about how they're different from dogs. I'm going to do a little drawing, so please give me a little understanding here. I'm not an artist, but it is very important to have your cat's teeth checked. And a majority of cats do need dental x-rays when they have dental done because they like to hide their disease. So I'll show you why that's the case. Cats, actually, let me start with this color. This is going to be my gum line, okay? Nice pink gum line, okay? And this is going to be your tooth that you can see, okay? So it looks okay from the outside. This tooth looks beautiful, but this tooth has two roots up here, sometimes three, sometimes four, okay? And what cats like to get is resorptive lesions. So under the gum line, the cat's own body likes to attack its tooth roots, okay? Causes inflammation, and the inflammation likes to break down the periodontal ligament and eventually break the bone down. So we will actually x-ray cats sometimes, and we will see that they will actually have big pieces of their tooth just missing, okay? We'll see that they have big holes in their teeth up under the gum line, and really there'll be minimal evidence of this on the surface. Maybe we'll see a little redness, maybe a little bit of tartar, but we're not going to see, let me do a little tartar, just a little, but it's not going to give you a good idea of what's going on under that tooth. And what's going on under that tooth is extremely painful, okay? Here's my cat mouth, all right? You can see, again, this root on this canine is almost bigger than the tooth itself. So that's a lot of tooth that can become diseased and infected and angry before you actually see evidence of it on the surface. And then these are the roots. See how big that is? And those roots really like to get infected. They really like to get eaten away. And sometimes these teeth will even break off and the roots will be left under the surface and you'll actually have this portion of the tooth gone, okay? So this is extremely painful for a cat. Cats are tough. Cats won't always eat despite pain. Sometimes we've even had cats that were angry cats or cats that aren't very social and like to not be with the owners as much, not be loved on as much, or maybe you're a little when you do go to touch them around the head and people just think, oh, it's a cat. Well, it's not always a cat. A lot of times it can be associated with dental pain. I've had so many owners. I do dentals on cats. We do extract a fair amount of teeth because, again, these teeth are diseased. These roots need to come out. And they will call me and say, oh my gosh, they're sitting on the couch with us. Oh my gosh, she's eating better. They're letting us play with them more. And a lot of it was associated with pain. So I do think that we need to understand that cats react differently than dogs to disease. The body likes to cause more of an issue in cat roots, and unfortunately most cats do require more of a dental to fix the problem and more extractions. So sometimes it is a little bit more cost-wise and a little bit more recovery, but we really see it pay off in the long run when we are on top of these cats' teeth and we're really helping them out. The x-rays that we take as part of the dental procedure show us that disease under the tooth. So I pulled up one that's pretty good evidence. You can see the surface of this tooth? That's normal. Look at how pretty that looks. And then look at how this is eaten away. The body has just eaten holes in the roots of this tooth. Look at this one. This tooth actually has broken off. You've lost a lot of the bone, and there's actually roots still present on the tooth. So it ate through the middle of the tooth, broke off, and you have roots present. That is painful. That is still reactive. That little black area right there is evidence of inflammation and infection, and this cat is painful right there. So those need to come out. The roots need to come out, and those other teeth need to come out. Now sometimes the body will be doing it, and you see this? You should not have things like this. You should not have areas where it's eating into the tooth. And here, you actually can almost not tell where the root is versus the bone. And that's because the bone is eating away at it so much that it's virtually dissolving the root, okay? And the rest of this tooth is going to be very painful. It's going to be movable sometimes, and the cat is going to be uncomfortable. Here's another one. Again, look at that. It's just eating away at the tooth. That's much thinner than it should be. The black means there's been bone loss. So this cat needed a big dental procedure, needed a fair amount of extractions, which we did. With cats, we do have them come in early in the morning. We do some lab work to make sure that they're okay to go under anesthesia. They get IV catheters, they get fluids during surgery to maintain blood pressure, and then we do our dental x-rays. Based on the x-rays, we decide how many extractions need to happen. They get good pain control. We give them a happy shot of an opioid so they sleep really, really well post-procedure, some pain medications to go home, and sometimes antibiotics depending on how diseased the teeth are. So I do highly recommend dental x-rays in cats with their dentals. Highly recommend you have your veterinarian take a look at your cat, and you kind of think about my cat and how they eat and how they act, and could there be pain that you're missing, okay? The other condition that cats like to get, because they don't like to get just one nasty dental issue, right, is they like to get stomatitis. And stomatitis, I have a picture here actually, if you want to come and look at this. But you can see, look at how angry and red that gum is. And it's all throughout the mouth. So it's not just one tooth that's kind of infected. This is every single tooth in the body. And we will see this in cats that are only a couple months old. We'll see it in very young cats often. And this is actually a condition where the body, again, is reacting to the teeth. It's a condition that has more to do with the immune system. And unfortunately, these cats do usually require extensive extractions, often full mouth extractions, to relieve them of this painful condition. If you can imagine having swollen gums that bleed every time you touch them, this is very painful, and often cats need extensive dentals to correct this condition. So you can always check your cat's mouth for this. If you see redness along everything, and especially if you don't see just one tooth affected, you may need to get your cat examined for stomatitis. Couple other things that are just other questions that we got is bad breath in kittens. So if your kitten doesn't show evidence of stomatitis, but man, they get in your face and you're like, oh, you're so cute. Ooh, but that breath. There is a couple things that can help. There is a food called TD, which is a tooth diet, and you can feed it as a treat to your cat. I actually like to put it in the little ball that my cat plays with to get energy out, and the treats fall out and they'll eat them. And it helps to reduce the halitosis that some cats can experience when you don't find a disease process that's causing it. So TD treats are certainly something that I would look into. There's actually food that you can just feed if that's easier. There's greenies for cats, which a lot of people do like. It depends on your cat and whether they like treats or not. But there are a couple of things that you can do for bad breath. Prevention-wise, I have a couple great owners with great cats, and they do brush their cat's teeth. I do think that helps. It helps maintain the gum health, and it helps reduce tartar. But overall, there has never been a cat that I have seen that did not at some point need a dental exam under anesthesia with x-rays and possible extractions. A majority of the cats will develop resorptive lesions. They will get painful, and they will need an extensive dental workup. So, big difference between cats and dogs. You may have more questions. If so, you can always call us at 817-488-7533. We're really trying to educate because coming up in February is dental month, and we are doing discounts on our dentals just to kind of help some owners out, especially if you need a bigger procedure. And we're already booking up. So give us a call if you get a chance, and we can get you set up to do an exam, see what we might be able to do for your pet. Make sure that you give those cats lots of loves and snuggles, and let us know if you need anything. Thanks, guys. Have a good day.